Hey class, it's lecture time again. We're now in chapter 2, communication and documentation. Chapter 2, communication, computer essentials, and documentation. Our objectives for this chapter is going to be to outline the basic communication loop, describe methods for effective verbal and nonverbal communication, which includes active listening as well as written communication, list examples of positive and negative body language, describe methods to achieve cultural competence and sensitivity in the workplace. Describe basic components of the medical record and provide examples of how to maintain confidentiality and privacy related to patient information. Describe essential elements of the laboratory test requisitions, specimen labels, and test results. Identify potential clerical and technical errors that may occur during labeling or documentation of phlebotomy procedures. And identify essential components and functions of computers in healthcare and list ways that healthcare workers use them to accomplish job functions. Communication strategies for healthcare workers. Nobody communicates alone, and communication happens when one person delivers a message so that the sender gets the desired response or reaction from the receiver. Effective interpersonal communication is viewed as a communication loop. We see as a healthcare worker, you may be sending a message. Your patient will be the receiver of that message, and your patient has to encode what you're saying. And there are a lot of factors that can influence whether or not they receive the message that you're trying to deliver to them. Some of those things that can influence whether or not that patient receives the message that you intend is medical terminology that's being used. They may not understand things in terms of the medical terminology. Language differences, sensory ability, such as having speech or hearing impairment, pace, tone, and volume of your voice, the urgency of the situation, cultural meaning, environmental noise from the TV or medical devices, or it could be other people in the room, and as well as gender or age. Face-to-face communication is the most effective communication. We see here are illustrations of other forms of communication. Now, some healthcare facilities have what's called the readback policy, and this is a policy used to ensure that the communication is accurate. And an example of that is, for example, with doctor's orders, you would repeat back what the physician said in order to make sure that you understand exactly what he said. And so what you repeat back to him, he will in turn acknowledge that that is correct or incorrect, and then corrections can be made at that time versus not completely understanding what was said and then errors occur. Here's an example of the readback policy. Doctor's orders and test results can easily be misunderstood, especially when given over the phone. Anyone taking doctor's orders or test results by telephone should write them down and read them back to the caller. So you want to listen closely to what is being said. Write it down if you have to, and then read the message back and confirm that what you read back is accurate. There are 4 essential components of communication. You have verbal communication, which is the actual spoken word. You have your nonverbal communication, which is your body language. Active listening, which is your verbal and nonverbal information is used to assess the situation. And then text-based communication, in which language is used electronically in the printed form or handwritten. Healthcare workers are most professional and effective with patients when they show empathy towards the patient, show respect towards the patient, build trust, establish a rapport, listen actively, and provide specific feedback. On occasion, the healthcare worker may need to sit down near the patient to spend extra time explaining the procedure or to answer questions. This healthcare worker is actively listening to the patient's concern in a compassionate manner. Listen actively, face the patient, and maintain no authoritative posture towards them. Lean in towards the patient and establish eye contact and listen intently to what they're saying. Provide specific feedback about their behavior or about the procedure. Use simple, straightforward vocabulary and use proper pronunciation and grammar. Avoid using any complicated medical terminology or jargon that they may not actually understand. Communicating across generations. Millennials are the youngest of the workforce, and they may actually value some of the same things as the older counterparts. So, healthcare workers can benefit from having an awareness of the common things and differences among generations. And then you will come in contact with people whose language is other than English. And there are about 460 languages that are spoken in the U.S. Patients do not speak English, who do not speak English, can sometimes understand basics from nonverbal cues. Healthcare workers must know how to access translation services if needed. And here's just an illustration of the time periods that characterize your traditionalists, your baby boomers, Generation X, and Generation Y or millennials. You'll have to communicate with other groups of people, such as your LGBTQ, who consist of individuals who are lesbians, gays, bisexuals, transgender, queer, or individuals who are questioning their gender identity. Transgenders are individuals whose gender identity or expression does not align with their assigned birth sex. And then another group of people are your immigrants and refugees may have language differences, cultural differences, and fears of being in a new country. So it's helpful to their clinical condition for them to feel safe in their healthcare environment. This is especially important because if they don't feel safe within the environment, they may not disclose any information to you that you will need in order to carry out the task that you need to do. Dealing with patients with sensory impairments, healthcare workers should be knowledgeable about and sensitive to patients who have impaired hearing or sight. All patients, regardless of their impairment, must understand healthcare procedures before beginning. If a patient does not hear, try speaking slightly louder but not shouting, and slower, and repeat statements if needed. And then for each patient, you'll want to select the best option of communication. Sometimes you may have to use written instructions. You may have to use audible aids or a tablet or tablet computer or smartphone, etc. And seek assistance from language interpreters if needed. When dealing with patients with vision or sight impairment, they can have low vision in which they can see degrees of light or some images. And this is often caused by macular degeneration and or diabetes. Some patients may be blind, and these are people who need alternative techniques to do the same task that a sighted person can do normally. And a good illustration of this is in our picture below, where the person is saying go over there, and this person is sight impaired, and they uh, say where is over there. And then you have your braille, the written system for sightless individuals, and a clear indication of a vision impaired person is they may have a guide dog or a long white cane. When interacting with people who are visually impaired, speak directly to the patient. Do not raise your voice or speak to a companion if there is one. The patient cannot see you, so introduce yourself as you shake hands. And patients who are blind are entitled by law to use a long white cane or guide dog. Move furniture or medications out of the way prior to venipuncture procedure. And let patients know who's in the room with them if there are others present. Describe all procedures thoroughly and offer answers to any questions. Do not ask questions because you're curious about their blindness. And do not make small talk about the patient's other senses. And the thing to remember is most patients who are blind do not want to be fussed over. When communicating with people, you want to keep in mind there are zones of comfort for people. You have your intimate space, which is space shared within close relationships. This is a distance such as when you're whispering to someone, embracing. Um, you're in someone's intimate space when you're performing venipunctures, okay? Or for people who are engaged in helping to bathe, feed, or dress patients. Now, your personal space is a space that's shared among friends and also includes many patient encounters. And then your social space would be interactions of everyday life. And an example of a public space would be for lectures and speeches and concerts, etc. And here we see an illustration of what the distance between each of these zones of comfort entails. Cultural sensitivity. Culture is a person's values, what's acceptable principles to that group, beliefs, which is their doctrine, their faith, their spiritual orientation, traditions and practices, what are their customs, holidays, foods, music, dance, and art. And it's important that you consider your own culture and remember that people from different cultural backgrounds may not share the same culture or values that you do. So it's important that we are sensitive to that in order to maintain harmony and make sure that we are able to effectively communicate and complete whatever task we've been assigned to do with the patient. So we're going to stop there, and your assignment will be to complete this scenario. You have to do a venipuncture on a patient who's sensory impaired. Explain to me how you would communicate with that patient. And I will see you guys next lecture. Bye-bye.